Safety talk because I had given one years ago. I went and dug up my some of my old slides. So this obviously is a picture with a ball hitting the tip of a finger, but this could happen with a kickback where you rupture the extensor tendon of the tip of the finger. And then you wind up with a finger that looks like that. You probably have seen people with fingers like this from sports injuries or whatever, but this would be an injury you might see with a kickback.
So Bob, maybe a lot of people don't know who you are and what your background is.
Yeah, I'm a retired physician. I practiced in family practice, military medicine, and then I finished up with wound and hyperbaric medicine before I retired.
So a lot of these wounds you're going to picture today, maybe you've seen some of these.
Oh yeah, oh yeah.
Oh yeah.
But this was a typical one I'd see in my family practice, you know, from people playing ball, whatever. And it's an extensor tendon, as I mentioned. You can either break the tendon or you can rip a piece of the bone off with that type of injury, and then you get this mallet finger. Yeah, oh yeah, it's fixable, but you've got to get it attended to right away. This is I always love how they use New Jersey as, I'm from New Jersey originally, how they use the word Jersey or New Jersey for all kinds of things. And this, they call it Jersey finger. This is where the flexor tendon in the finger has been ruptured and you can't flex your fingers or your fingertips. Another injury that could develop if we're from a kickback off of a saw or from carrying something heavy and then or it begins to fall and you try to catch it and so forth. This is another injury that you'll see with finger injuries. All of the fingers, when you fold them up in your palm, are supposed to point in the same direction towards the base of your thumb. And if they don't do that, then that usually indicates you've had some sort of an injury, as this picture depicts. Another diagram of the flexor tendons and the sheath that they ride in. Those A2, 3, and 4 are the sheaths that the tendons ride back and forth in. An injury to any of those could lead to various types of finger disabilities. A picture mostly to demonstrate the median nerve, which enters into the hand and supplies primarily these three fingers and the medial half of the fourth finger, the ring finger. And that's where you get the term carpal tunnel syndrome, because the nerve gets entrapped beneath this tendon, and you'll get numbness of these fingers. And when that happens, you're not able to button a button, for instance, on your shirt. And so this would be an area that we could get into trouble with since we work with our hands a lot. When this median nerve, this yellow representation here, becomes inflamed, or there is swelling of this thick tendon that overlies it, you can get carpal tunnel syndrome, and you can lose the sensation and a number of the fingers of the hand. So if you ever notice that that's beginning to happen, and this can happen just from age, you don't have to be a woodworker or whatever, but it does happen with people that are involved with using their hands a lot. And Dave just simulated a typist, and it can happen with people that are typing for a career, using a mouse for their career or their hobby or whatever. But just the aging process alone can cause that. I would go see a hand specialist, because they have a release procedure that they can do to make everything all better. Sometimes they don't have to do surgery, they can do injections, but oftentimes they will do a release procedure of the nerve, a small incision in the hand, and you're fine from that point. This is commonly called a gamekeeper's thumb, where the thumb gets yanked to the to the side, and then you rupture the tendon. Can even break the bone. Commonly seen in gamekeepers, but you can see it in our particular hobby, grabbing things, holding on to things, getting kicked back, and so forth. This is a tendon that is involved with extending our thumb and also extending our wrist. And it rides in this part of your wrist. And it's an area where you can develop an inflammation and have a lot of trouble moving your wrist side to side. And it's called Decravane's tenosynovitis. Some of you may have heard of that. You may have even had that. Another thing to go see the hand specialist about, and an injection of steroid in this area oftentimes will get it to do a lot better. This is another representation of that, where you go to either extend your wrist or flex it, and you get a lot of pain in here. Another frequent problem we see in our line of work, but anybody can see this, is smashing your finger and getting a hematoma under the nail. When the hematoma is entrapped and can't leak from under the nail, you can get a lot of pain, and it can throb like heck. It can keep you up all night. You can take a small drill and drill into the nail to relieve the hematoma. And then in my practice days, I used to heat up the end of a paper clip, and I would burn through the nail, and that would relieve the blood under pressure under the nail. It's called a subungual hematoma, and it can be quite painful until you relieve the blood.
If you don't relieve it, you're going to lose the nail, right?
Well, you'll lose it anyway. Either way, you're going to lose the nail. But if you can get that blood to ooze out of the nail, or you'll get a lot less pain. You'll feel a lot less pain. And this is a trigger finger. Another thing you can see in people that work with their hands, where they can flex the finger, but then they can't straighten it out. They may have to use their opposite hand to straighten the finger. And that, again, is all due to the tendons and tendon sheaths that the tendons ride in that can get inflamed and then can lock your finger. If you develop a sprain or some sort of an injury to the finger that's not severe, you can oftentimes buddy tape the two fingers. One finger acts as a splint for the injured finger, and you want to put some gauze in between to absorb the sweat. And then the tape, if you have a lot of swelling in the finger, if you overlap the tape, as shown here, that may not be good for swelling because it may not allow the swelling to proceed. So instead of overlapping the tape like this, you may want to take the two ends of the tape and join them up like that. And that will allow some swelling of the finger. Serious injury. If there's one finger injury, it's usually the index. If there's more than one finger, it's usually the first three fingers of the hand, excluding the thumb. Of course, you can injure the pinky finger. The surgeons are pretty good about putting fingers back together if there's been severe injury or amputation. You might see something like this from a planer if your fingers are too close to the planer, or to not the planer, the jointer. If you're holding the wood against the jointer and you got a finger a little too close to the rotating blade. And you might see something along these lines if you get your fingers caught in between the tool rest and the rotating piece of wood you have on your lathe. You might see in somebody that's pushing a piece of wood through a bandsaw and they just got carried away without using a push stick of some sort. Again, another injury that you might see with any kind of a blade, including a jointer. The finger obviously is composed of tissue, skin, muscle. This would be the tendon and then this would be the bone. And then along the sides of the finger is where you'll find the blood vessels and nerves. If indeed there is a finger amputation, it's good to rinse it off to get the dirt and the sawdust and everything off of it. Put a piece of dry, clean gauze, sterile if you have it, around the finger. Put the finger in a baggie, a clean baggie, and then take that baggie and put it in a baggie that's full of ice. You don't want to put the finger into the ice without putting it in a separate baggie. You want to bring it relatively dry to the surgeon to get reattached. You don't want to have it sitting in the ice to develop maceration, and there's a chance that it may not be able to be reattached. This is a degloving injury. You can see this with some of the machines that we use, especially like a lathe or a belt sander, where your finger gets caught and just yanks the tissue off the finger. I had patients come in that their wedding ring would catch on something and then deglove the finger. I've also seen it in people walking a large, strong dog, and the wedding ring or engagement ring gets caught in the leash, and the dog sees something and runs and degloves the finger. But again, the surgeons are pretty skilled. They can get skin back onto the finger. Amputation, again, the surgeons are very good about reattaching these things.
Typically, how much time do you have from the time you've lost a finger to the time you get to the doctor with it?
I mean, obviously, hours you may lose the finger for good. But if you're within, I'd say, an hour from first aid at a hospital or a hand surgeon, I think they can get your finger back on and get you a fairly decent result. And cooling the finger in that bag of ice would slow down beginning of necrosis that you would see in a finger that has no blood supply. This guy lost his thumb and then had it reattached. So it's not a good-looking thumb, but it's a thumb that works. You definitely don't want to lose your thumb if you can avoid it. It's one of the more important fingers. So when they analyzed the number of the type of injuries that you'll see in the woodworking industry, this is the pie chart that they've come up with. As you can see, amputations are relatively small, but crush injuries, fractures, cuts, sprains, encompass the majority of the injuries. With a cut, you really only need soap and water. You don't need to do all kinds of applications of ointments and antibacterials. You really just need soap and water and then a clean, preferably sterile bandage. Hand position and obviously pushing and feeding provide the most injuries of the hand in people that are using their hand and machines, using their hands and machines. Dermatitis obviously is a big problem. Not everybody has skin that responds negatively to toxins. I know if I get a lot of solvents, if I use a solvent and don't have a glove on, it just tears the hell out of my skin. And certain woods, if I'm not wearing a glove, the oils or the sap from the wood, again, will tear up my skin. Toxic woods, made a handout. These are the most toxic woods that I was able to find in the research that I did. I've heard of a mangrove, but never a milky mangrove, but apparently the sap is highly toxic. It'll just tear up your skin, and if you somehow ingest it or inhale it, you're probably in pretty tough shape. Mimosa, I thought, was a drink that you can have in the morning with, I never knew that there was a tree by that name, but there is. Very toxic. Oleander, I thought, was an oil that you could use in cooking. My wife said she's never heard of it, but it's a tree that the dust is highly toxic. Sassafras, I thought, was a bluegrass tune. but it turns out it's, again, a very toxic wood. And yew also is a very toxic wood. I've looked these up, and they're beautiful woods. They're hardwoods, and they're just beautiful. But boy, are they toxic. Noise is another thing we're exposed to. The problem with the hearing is hearing can only get worse. It can't get better. It doesn't get, once you injure your hearing mechanism, it doesn't get better. So you have to be very careful with this. The exposure of 85 decibels is probably the upper limit. As you can see, if you use any of these machines, you've got a lot higher than that. Of course, there's a time element for how long you're exposed. And the injury is not only to the mechanism within the cochlea, but it's also a metabolic injury to the hearing mechanism. So you've got a lot going on when you're exposed to excessive noise.
How do you know when it's too loud?
Well, I think if you can tell that it's hurting your ears to some degree, it's probably too loud.
I was told that if we can't have a conversation over that noise, then it's probably too loud.
Yeah, and I know if a noise is above about 80 to 85, I know it hurts my ears. And I've got this nice Apple Watch that I can check the decibels on.
There's an app you can get, NIOSH, N-I-O-S-H. It's a free app, and it'll literally, this is telling you what the decibels are right now in here.
Wow.
I use it all the time just to check stuff out.
I mean, there's obviously other reasons. There's other reasons why people lose hearing, but noise damage is a big one. But a lot of the machines we use are just very loud. I use my hearing protection for the lathe even, which technically is not that loud, but it's just it's the prolongation of the exposure, you know. Yeah, that's the other thing. The ringing in the ears is called tinnitus, and that can be so loud. Some people have committed suicide on account of it. But the ENT audiology people can settle that down quite significantly with the use of a hearing aid type of device. So if anybody has that and it bothers them, keeps them up at night, there's something that can be done about tinnitus, you know, hearing the ringing. So these are some of the exposures and the length of time that, you know, is something that is recommended in terms of how long you should be exposed to the noise from these things. People using jackhammers and things would wear hearing protection, but I've passed road crews and I've seen guys with the jackhammer, there's nothing on the ears. Dust is a biggie. This is the handout I passed out. It's not readable on this, but dust is very toxic, especially over long periods of time. Nasal cancer, lung disease, oak, mahogany, beech, walnut, birch, elm have been reported to cause nasal cancer. The jury is still out on this, but there are some specialists, some organizations that study this stuff say that the dust from these types of woods can cause nasal cancer and lung disease. And these are obviously the woods that we love to use the most. Who doesn't love walnut and elm and ash, beech, you know? So it has to be the woods that we love are the ones that, you know, can cause us a lot of problems. The fine dust that we have in our shops, that you can't see it. You're trying to suck it up with all of these vacuums, but we can't see it until the light shines through and you can see this stuff floating around. This American Conference of Governmental Industrial Hygienists say that these woods are confirmed carcinogens, and 1 milligram per cubic meter of hardwoods and 5 milligrams for softwoods are considered possibly toxic. And when you think about a cubic meter, 1 milligram is hardly anything. you know, you could probably fit 1 milligram of dust on the tip of your finger, and that's floating around. And if it's hardwood, we're supposed to not be inhaling that at all. And we probably are. Even when we finish working and we take our equipment off, it's probably still floating around. Probably the next day when we walk into the shop, it's still probably there floating around. So these are the size in microns. Suspended dust is very, very tiny, smaller than most viruses and bacteria.
So an N95 mask filter them out?
To some degree, but not 100%. As you can see, we're wearing the N95s for the past couple of years because of viruses. As you can see, the suspended dust can be even smaller than virus. And so they probably can make their way through the sides of the mask. And as Dave was saying, if you finish your work and then 2 days later you come back in your shop, it's probably still floating around in the shop. And that's called respirable particles. And they can get deep into your lungs, so deep they're never coming out. And they're down in the 0.1 to 0.001 micron level. The particles that can be inhaled through the nose are a little bit larger, but they can go all the way down to the smallest particle. Yeah, asbestos was in here. It's small, and it's in the range of respirable particles that can get deep into the lung. And once they're there, they start to cause an inflammation, and then it will cause scarring and then can cause a cancer. You can actually see a cancer develop from asbestos exposure. These things are helpful. Probably this thing is a little bit more helpful. But we probably almost need to, if we really are worried about dust, we probably almost need to wear a spacesuit in our shops, you know. Eye injury, I used to see this a lot in my practice. This is a laceration of the cornea from something flying into the eye. It is very painful. Once in a while I had to dig one of these things out of the cornea. You'd numb up the cornea and take a sterile needle and dig it out. Sometimes you'll see a rust ring develop around this thing, and you'd actually have to try to scrape the rust ring if it was a piece of iron that went into the eye. This is a nail gun injury, obviously. You can see the ridges. So this is blood in the anterior chamber of the eye. This is called a hyphema. The eye, blunt trauma to the eye. This is an emergency. You want to get in to see an ophthalmologist right away, or the emergency room, whichever is easier or quicker. This is a little piece of debris or metal or wood that gets under the eyelid. These darn things, when they get caught under the eyelid, can just scratch your eye. They can hurt like heck. If you can't flush this out, you probably need to get in and either have an ophthalmologist or an optometrist remove it. They can numb up the eye and remove these things. Laceration of the eye. Again, something flying into the eye, a chip of wood or something. So it's so important to protect the eyes. This is a blunt injury to the eye. The injured side is the left side, believe it or not. This individual's trying to look up and he can't because he was hit by a baseball. And usually if you have blunt trauma to the eye, like a fist or a baseball or something, it's usually the floor of the eye socket that breaks and caves in. And then that will entrap the muscle that we have down there and not allow the eye to be raised when you go to look up. So another reason to use eye protection. And, things come flying off those lathes at high speed. And if they have any weight behind them, they can injure our eyes severely. And then I got something on lifting and carrying. This is from a British book for people that work in factories and woodworking shops and so forth. And they have a method that they've devised over the years on what you should carry away from your body or close to your body, whether you're male or female. Kilograms, I think you multiply it by 2.2 to get pounds. And if you have to move the object between two fields on this diagram, you're supposed to use the lesser of the two weights. Obviously, anything close to the body, you can haul more weight or lift more weight or carry more weight. Anything further away, you've got to lessen the amount. And what happens is with lifting often, we can not only injure our shoulders or arms or whatever, but the back is the big thing that people seem to injure. This is a normal looking representation of the spine, but here you'll see the herniated disc. There's a gel-like material surrounded by a fibrous material in our spine, and when that fibrous material ruptures, the gel-like material can rupture back and compress the nerve, which is represented by yellow, and then you can get sciatica. Either due to degenerative arthritis or an injury, you can break the pedicles in the back of the spine, and then the whole spine can shift forward and can compress the spinal column, and you can get injury and pain and nerve damage from that. So a lot of things that you need to consider when you're lifting, especially some of this heavy equipment that we're hauling around in our shops. Regarding turning, David Ellsworth, I've seen some of his videos. I think when you go to his shop to engage with him on some sort of learning process, I think he actually puts you through stretching. I've seen him on the floor showing the other people in his class how they should stretch out their back and their limbs and so forth.
It's in his book too, it shows all.
Is it in his book?
exercises, yeah.
So that's not a bad idea. I was thinking of getting the book, and this is what's called ventricular fibrillation. This is commonly seen in a cardiac arrest. This is a rhythm that will develop in an arrest before the heart finally decides it's quitting for good. And if you have a cardiac arrest and this rhythm is going on, if you can get to the person, besides the CPR where you're pushing on the chest, you get one of these things on them, you can frequently change that abnormal rhythm back to a normal rhythm and get them, to medical care. So I was thinking, in our Guild of New Hampshire Woodworkers, we've got a lot of guys that are 50 and older. And should we be thinking of having one or a couple of these things around? Yeah, no, the AED is totally self-explanatory. It shows you where to put the pads, and it talks to you. And it tells you when to shock the patient and when not to, when to back away for the shock so you don't shock yourself and so forth. And then obviously everybody should have some knowledge of CPR, even to save a family member. A kid swimming in your pool drowns, and things like that. You might be able to save one of your own family members besides a shop member or whatever. And then it's good to have one of these things available for whatever ails you. And then if you do cut your finger, your arm, whatever, and you get bleeding, especially if the blood is spurting, direct pressure is what you need to stem that bleeding until you can get a dressing on, a pressure dressing or whatever, and then go get whatever medical care you need.
And a tourniquet?
Tourniquet would be something you could use, an arm or leg that you've got severe, you have severe arterial bleeding, but if you're going to apply a tourniquet, you'd want to get immediately to an emergency room or to medical attention, because the longer that tourniquet's applied, the likelihood you're going to lose the part that's below the tourniquet. So, but again, you would immediately work on stemming the bleeding to get that tourniquet off. So that's the end of my